Welcome to the series, Teaching Videos, Germanic Heilkunde, by Doctor of Medicine and Magister of Theology, Gerd Hummer. My name is Helmut Pilhar. I am the father of Olivia and a lecturer, authorized by Dr. Hummer, on Germanic Heilkunde theory. The cause of the diseases that arise of their own accord is monocausal, the biological conflict. At the moment of the conflict shock, we associate. This associated conflict content determines the localization of the Hummer focus in the brain, and thus the organ disease. These biological conflicts are archaic conflicts, such as conflicts of morsel, disfigurement, self-value, separation, and territory conflicts, which are equally valid for the animal. To be able to understand this conflicting content, medicine must be understood from the history of development. Only then does a natural logic and biological sense of the various so-called diseases emerge. Nature does not do anything good or bad, but always only something sensible. The aim of this chapter is to learn, to understand that each sensible biological special program helps specifically and purposefully to solve the cause, that is, this biological conflict shock. You can learn more about this in the 60-minute teaching video. History of Development. Ladies and gentlemen, I would like to welcome you to this seminar on Germanische Heilkunde, by Dr. Med. Gerd Hummer. My name is Helmut Pilhar. I am a lecturer, appointed by Dr. Hummer in Germanische Heilkunde theory, which is a great honor for me. Originally, I am a technician. I graduated from the Higher Technical College of Electrical Engineering, and then from the College of Mechanical Engineering. My last position was as a software engineer. I have been married since 1990 to my wife Erica, with whom I have 4 children who are now grown up. Because of our daughter Olivia's cancer, in 1995 we came across Dr. Hummer. That got us into a medical dispute, which continues to this day. Since 1997 I have been teaching the science of Dr. Hummer. Dr. Hummer said, to understand medicine, we have to learn to understand it from the history of its development. He was referring to the 5 biological laws of nature, to the understanding of each so-called disease, as part of a sensible biological special program, understandable from developmental history. That is, in the context of our evolutionary history. If you have understood the 5 biological laws of nature, discovered by Dr. Hummer, the quintessence, then you have lost your fear. After all, why should one be afraid of a symptom that helps to solve its own cause? As long as one has not eliminated the cause, the symptom keeps coming back, and one is chronically ill. Then one naively runs to the conventional physician, who only fights symptoms. And with his diagnosis of evil, which is what malignancy means, one catches the next conflict, and becomes sicker and sicker for fear of the supposedly inevitable. In reality, this division between good and evil does not exist in nature at all. Think for yourself. Is the day good, and the night evil? Is the storm malignant, and calm benign? Is the cat bad if she eats the mouse? Is the mouse bad if she does not let the cat eat her for food? No. This attitude is unnatural. Nature only ever does what is sensible. And since we humans are part of nature, it is impossible for something good or evil to take place in our bodies. Only something biologically sensible can take place. We just had not understood it until now. We should not be afraid of the symptom. It is much more dangerous not to solve the cause. And, of the causes of the different symptoms, conventional medicine has no idea. The cause of intestinal cancer, breast cancer, heart attack, and so on can only be understood if we understand the biological language of nature. What exactly is one doing in an indigestible morsel conflict, a conflict of worries, or a territorial loss conflict? Quick tip. This biological language of Mother Nature applies not only to us men and women, but also to the infant, the unborn child. Even to the animal. The dog, the horse, and so on. The language of nature is interanimal, and cross-species. The Germanische Heilkunde, with its 5 biological laws of nature, is valid for humans and animals and even plants. Let's learn this biological language together now, so that, by understanding the biology inherent within us, we lose our fear. This language is not so strange to us. We have many idioms in the German language that hit the nail on the head. For example, when we say, "The trouble with my mother-in-law sticks in my stomach," or, "I've bitten out my teeth," Or, you broke my heart. Or, I was verbally attacked. Shortly, we will learn how to find biological conflicts. Biological conflicts need a biological solution, which is another thing we have to understand. When medical practitioners, including alternative medicine practitioners, don't know causes, they can't eliminate them. With conventional psychology, you can't get anywhere. Nor with esotericism, with which Germanische Heilkunde has nothing to do. Rather, a look into the animal kingdom helps us. Animals in the wild are a little wiser, biologically. They solve their conflicts instinctively. Unfortunately, we humans in our civilization scrap society, as Dr. Hummer calls it, have forgotten how to do this. So we're going to learn to use our conscious minds, to control what was previously in our bodies, which was previously in our unconscious. As a reward for our efforts, I hold out the prospect that we can finally become our own healers. Even more, we can help our dear relatives to heal. Ernst Haeckel, 1834–1919, was a physician who coined the expression. Ontogeny recapitulates phylogeny. In plain language, embryonic development of the individual is a repeat of the phylogenetic development of the species. In other words, during these 9 months of pregnancy in our mother's womb, we pass through the entire human species development, which is estimated to have taken a few 100 million years. Haeckel is officially considered controversial. But Dr. Hummer thinks Haeckel is right. Dr. Hummer can confirm Haeckel's opinion through brain relays in the brain, and based on organ remnants from grey prehistory, still present in our bodies. For example, many millions of years ago humans were female. Remains of this can still be seen today in men, with their nipples. Why should Mother Nature gives nipples to the man? To play with? Many people, especially those who take the Bible literally, the creationists, have a big problem with the idea that we humans should have common roots with the animal. According to the creationists, 5,777 years ago, God snapped his fingers, and human beings were installed. Naked on earth, in their present form. Similar to the movie Terminator. As a professing non-religious person who only worships creation, I have no problem with the idea that as a mammal, I have something in common with my Rottweiler dog Emma. She has eyes, ears, and mouth. Lungs, heart, skin, etc. like me. She eats and shits, like me. She also reproduces similarly. She can feel fear, joy, anger, and boredom, like me. She loves to socialize, and has a penchant for games, like me. I find my dog very likable, and I like her very much. She also has a psyche, like me. And she can suffer conflicts like me. As a non-religious person, what's mysterious for me is living in and of itself. What makes life? What is the difference between living and not living? How did it come about? No one can explain it. Nor has it ever been observed that from the non-living, something living would arise. Take note. Dr. Hummer has discovered 5 biological natural laws in the living. Life was given to us, and we can pass it on. I believe that passing on life is also our sacred duty to creation, and an essential part of the meaning of our existence. Moreover, our children and grandchildren give us so much in return. If one now looks back into embryonic development, one can say that our ancestor must have once been a ring-shaped, worm-like creature. Sea anemones still look like that today. The ancestral ring-formed creature had a primordial mouth. And with this one opening, it took in food and excreted feces. This little animal was solely a digestive machine, and had only one thing in mind, to eat and to reproduce. This little animal did not want more from life. It did not yet know social behavior. At this stage, it did not yet distinguish between partner and mother-child. Handedness had no meaning here yet. The little animal lived in the primeval sea. In the further course of its developmental history, there was a rupture of this ring structure, which made our upright walk possible. This straightening was not at the head, as shown in this diagram, but at the larynx. Let's look at the scientific diagnostic chart of Germanische Heilkunde. Here you will find a tabulation and correlation of the cause. That is, the conflict shock, DHS, the associated conflict content, and the organ symptom. In the first column, you will find the relevant special program. For example, intestinal cancer, breast cancer, and so on. In the second column, the cause, that is the associated conflict content at the moment of the shock. Morsel conflict for intestinal cancer. Worry conflict for breast cancer, and so on. The conflict shock always meets 3 criteria: highly acutely dramatic felt, isolative, and catching one on the wrong foot. Whatever is associated, at the moment of DHS determines the location of the Hummer focus in the brain, and thus the organ symptom. Nature Associates. We now seek to understand this biological language. In the third column, you will find the location of the Hummer focus in the brain. In the active phase, the Hummer focus is shaped like a shooting target, a bullseye. In the healing phase, edema, connective tissue fluid, is stored within the Hummer focus, until the crisis occurs. All B crises are symptoms of the brain. All B crises are symphatic-atonic with narrowing of the vessels, and often cold sweat. One is cold and also feels cold. With B crisis, this edema is squeezed out, keyword, peeing phase. Then, at the end of the healing phase, glia, specialized connective tissue on the nerves, is deposited in the area of the Hummer focus. Depending on the load of conflict, B crisis can be a split-second spike. Or it can also last several days. Conspicuous crises like epilepsy, absent thinking, migraine or heart attack, are types of cerebral cortex crises. In the fourth column, you will find the symptoms of the conflict active phase. There are 3 groups of special programs. The first group causes cell proliferation, tumor. The second group causes cell loss, necrosis, ulcers. And the third causes loss of function, neither cell proliferation nor cell loss. In the fifth column of the diagnostic chart, you will find the symptoms of the conflict resolved phase. That is, the symptoms of the healing phase. In the first group, we find tuberculous degradation of the previously developed tumor. In the second group, we find healing swellings of the previously formed necroses and ulcers. And in the third group, the function returns. In the middle of the healing phase, we also find different types of crises, which, as I mentioned, are all symptoms of the brain. Endoderm, inner germ layer. Dr. Hummer has now sorted all organs, according to the different tissue types, the germ layers. There are 3 germ layers, but there are actually 4 different tissue types. The glandular tissue, or endoderm, also called the inner germ layer, is colored yellow, in Germanische Heilkunde. In these special programs, we always find the Hummer focus in the brainstem. Ectoderm, outer germ layer. The squamous epithelium, or ectoderm, is also called the outer germ layer. It is shown in red. In these special programs, we always find the Hummer focus in the cerebral cortex. Mesoderm, middle germ layer, old. The middle germ layer, or mesoderm, is divided into an older group, the glandular-like tissue. Hatched yellow and orange. In these special programs, we always find the Hummer focus in the cerebellum. Mesoderm, middle germ layer, new. And in this younger mesoderm group, the connective tissue. The color used for this is orange. With these special programs, we always find the Hummer focus in the cerebral medulla. Organs of each germ layer. Each organ of each germ layer has a corresponding brain relay of that germ layer. The brainstem controls glandular tissue and smooth muscles. The cerebellum controls glandular tissue. The cerebral medulla controls connective tissue, and the cerebral cortex controls squamous epithelium and functional loss. Slowly, an order becomes evident, doesn't it? Which organ tissue reacts? In the same way that we build a house with different materials, the basement with cast concrete, the walls with clay tiles, and the roof with sheet metal. Our organs are often made up of all 4 types of tissue. These different cells also look very different, under the microscope. Just as concrete, bricks, and sheet metal look different. Take the example of the uterus. The lining of the uterus is glandular tissue, yellow group. The Hummer focus for the uterine lining is located in the brainstem. The muscles of the uterus are smooth muscles, also the yellow group. But the Hummer focus for this tissue is located in the midbrain. The cervical muscles, on the other hand, are striated muscles, orange group. Their Hummer focus is located in the cerebral medulla. And the cervical mucosa, where the pap smear is collected, are squamous epithelium, The associated Hummer focus is located in the cerebral cortex. Endoderm. Morsel conflicts. Furthermore, Dr. Hummer found that glandular tissue, yellow, is always about a morsel conflict. With the stomach, in yellow, there's either a cauliflower-like or flat-growing stomach tumor in the conflict-active phase. It sits indigestibly in your stomach. You have the morsel, but you cannot digest or convert it. In the intestine, yellow, the cauliflower-like or flat-growing intestinal tumor in the conflict-active phase means indigestible anger with an aspect of starvation. You thought you had the morsel, but suddenly it's gone. It can also be the indigestible anger you can't get rid of. With the liver, yellow, we see liver cancer in the conflict-active phase. I will starve. It can be a starving conflict for yourself or someone else. In the case of the lung, yellow, the alveolar lung nodule is in the conflict-active phase, fear of death, for oneself or someone else. Why does a fear of death affect the lungs? You can remember it like this. Without food, you can survive for weeks. Without water, you can survive for days. Without air, you will die immediately. It is about the morsel of air. With the pancreas, yellow, the pancreatic carcinoma occurs in the conflict-active phase. It's a fight for the morsel. Typically, inheritance conflicts are behind pancreatic carcinoma. In the choroid, yellow, there's a choroidal melanoma in the conflict-active phase, a certain image, face, object, event, that you cannot see or an image you can't get rid of. This is about the morsel of light. In the middle ear, yellow, we see middle ear inflammation in the healing phase, not getting certain information or not getting rid of it. Here it is about the auditory morsel. Ectoderm, separation and territory conflicts. The squamous epithelium, depicted in red, is about separation, and male or female territorial conflicts. With the outer skin, red, dry neurodermatitis occurs in the active phase. The conflict is to be separated, or to not be separated. The conjunctiva, cornea, and lens, in red, develop conjunctivitis, keratitis, and cataracts in the healing phase. This conflict is visual separation. It's separated from my sight or get out of my sight. During the milk ducts program, we see intraductal mammary carcinoma in the healing phase. The partner has torn himself from the breast. Or, the child has been torn from the breast. At the periosteum, there is rheumatism in the conflict-active phase. Brutal separation. A uterine cervix ulcer takes place in the active phase, producing a positive Pap test result. And in crisis, there is a pulmonary embolism. This is the female sexual frustration conflict. Coronary artery ulcers occur in the active phase. Crisis, there's a coronary heart attack. That's female sexual frustration conflict, or male territorial loss. In the case of the small curvature of the stomach, red, there's a gastric ulcer in the active phase, because of the male territorial anger conflict, or the female identity conflict. In the lung bronchus, red, we see bronchitis or bronchial carcinoma in the healing phase of the male territorial anxiety conflict, or the female fear-fright conflict. Old mesoderm. Integrity and nest-worry conflicts. The middle germ layered tissues are divided into an older and a younger group. The older group is glandular-like tissue, shown yellow-orange. Here we are dealing with violation of integrity, and conflicts of nest worry. The dermis, subcutaneous, develops melanoma in the active phase. This program is about defilement or defacement. Mammary glands develop mammary carcinoma, in the active phase with a worry or argument conflict. The pleura, peritoneum, and pericardium develop mesothelioma in the active phase. This is about the attack against the heart conflict. New mesoderm, self-devaluation conflicts. The younger group of the middle germ layer is connective tissue, shown in orange, the bones, tendons, cartilage, muscles, fatty tissue, dentin, lymph nodes, and so on. This group is always concerned with a self-devaluation conflict. A bone osteolysis program in the active phase, severe self-devaluation. A cartilage program with necroses in the active phase, slight self-devaluation. Lymph node with necroses in the active phase, slight decrease in self-esteem. The jawbone and dentin with osteolysis in the active phase, not able to bite. The muscular system with necroses in the active phase, self-devaluation due to paralysis. Organs related to the germ layers. Have germ layer related brain relays. Have germ layer related conflicts. Our ancestor lived in the primordial ocean. Its tissue was glandular tissue, and its conflict potential was the morsel, and its brain was the brain stem. Then our ancestor conquered the land. It needed additional organs, the inner skins, dermis, pleura, peritoneum, pericardium, to protect themselves from sharp stones. To control these organs, it needed an additional brain. The cerebellum. With its mammary glands, also from the cerebellum, the first social behavior was programmed. From now on, handedness was also crucial. Next, it needed a locomotion system. And for this, it needed an additional brain, the cerebral medulla. Finally, the most complex brain, which is our youngest brain, the cerebral cortex. This is where social behavior was programmed in. You see, the logic of nature, biology, is becoming more and more obvious. All of medicine becomes more understandable and easier to remember, even for us laymen. But this is not the only insight, by far. Let's continue by learning the biological sense of these special programs. Mother Nature has given this sense to us, so that we can solve the cause. A biological special program helps us to solve its cause, the biological conflict. Prepare to be amazed. Endoderm programs, the biological sense. Mother Nature, in her wisdom, has reckoned that one day we will greedily choke down a morsel that is too big, and now get stuck somewhere. Now, at the mouth end, a sensible biological special program might for instance start as a cancer of the intestine, which produces digestive juices by the liter. In order to be able to digest this stuck morsel nevertheless. This means that intestinal cancer is the biological sense. And it's not anything bad. Intestinal cancer helps to solve the cause by strengthening the function. One should not be afraid of the symptom. Rather, one should focus on the cause. If you fight only the symptom, as in conventional medicine, if you cut out the tumor, but you do not solve the cause, the symptom will come back. These biological special programs in our body can't do otherwise, because they are fixed, programmed, and unchangeable. There are no alternatives to natural laws either. For then there would have to be a second or third creation, which do not exist. So, only when this stuck morsel comes loose, only then does the cell division stop. Not before. What we need to understand about this biological language is that Mother Nature associates. In animals, this conflict is usually about a real food morsel. But with us humans, it can be an indigestible anger with the neighbor that gets stuck in the stomach. The special program starts in both cases, because to the software programmed into us, by Mother Nature. It's the same thing. And, if this conflict is now solved, the cell division of the conflict active phase stops. And the individual enters the vegetonic healing phase. The brain now switches on the corresponding microbes, in our example, the fungi and fungal bacteria. The now no longer needed intestinal cancer is decomposed by the microbes, in a tuberculous manner. Necrotizing, decomposing. You can imagine this like an apple rotting and decaying. And the healing phase also has the associated healing phase symptoms, such as blood in the feces, fragments of intestinal mucosa and tumor lumps in the feces, intestinal colic, and so on. Apart from feeling cold, a crisis in the brainstem feels rather inconspicuous. At the end of the healing phase, the tumor is gone and peristalsis of the intestine returns to normal. Harmless scarring remains. One is also completely healthy again from the conventional medical point of view, because the conventional physician can no longer find any symptoms. So, Mother Nature has not only given us a mechanism that solves the cause but, with microbes, she has also given us the surgeons who clean up everything. Ingenious, right? Here you can already see the paradigm shift in medicine, that Dr. Hummer has introduced with his Germanische Heilkunde. Where do you have to start with therapy? Of course, the cause rather than the symptom. In this case example, one must help the patient to solve his indigestible anger with his neighbor. The rest is done by Mother Nature in our bodies. In the rarest cases, when the patient cannot solve his conflict or when there is a large load of conflict behind it, We need emergency medicine, a surgeon. Chemo and radiotherapy, however, conventional doctors can keep for themselves. We do not need those. Another example from the endoderm group. The thyroid gland. Here is the associated conflict content. One was too slow to get the morsel, or too slow to get rid of it. For example, the student who does not have time to deliver the work in order to get the necessary degree. He will not be able to get the morsel of a diploma. The thyroid gland now multiplies cells in the conflict active phase, which strengthens its function. It produces more thyroid hormones, thereby making the individual faster, which solves the cause. People affected with hyperthyroidism can work for weeks, without having to sleep. The symptom, therefore, helps to solve the cause. And this, just like in the example of the intestinal program, occurs immediately, during the active phase of the program. If the cause can be solved, cell division stops. And in the healing phase, the tumor cells that are no longer needed are broken down by the same microbes as in the intestinal program. At the end of the healing process, the thyroid gland values have returned to normal. Similarly with the liver, the associated conflict would be starvation. In the active phase of the program, the liver grows tissue in order to produce more enzymes, to be able to optimally utilize even the smallest food crumb that comes from the intestine. If the starvation conflict can be resolved, the liver carcinoma is broken down tubercularly, that is, with tuberculosis mycobacteria. Or, take the parotid gland. Everyone knows the phenomenon that, when you're hungry, your mouth waters when you finally have the food in front of you. And that's just how you might start drooling, when you have a pretty neighbor you want to snack on. If this leads to a conflict, the parotid gland strengthens its function through cell multiplication, increasing saliva so that the desired morsel flows in better, or the unwanted one flows out better. And so, the biological sense of all special programs of the glandular tissue, yellow group, is always strengthening its function, in the active phase. Mother Nature thus helps immediately. And then all carcinomas are cleared tubercularly, with fungi and fungal bacteria in the healing phase. At the end of the healing process, the tumor has disappeared. I've now explained the functioning of so-called spontaneous healing to you. Spontaneous healing is defined as healing without therapeutic intervention, or healing by one's own power. In Germanisch a Heilkunde it is our declared goal, because only the individual can heal himself. There is no therapist who can heal, and no medicine which heals. So, self-healing has always been the only possible method. Old mesoderm programs, the biological sense. The tissues here are gland-like, too. And here, too, Mother Nature helps by immediately strengthening function, in the active phase of the program. As our ancestors conquered the land, they developed these inner skins, to protect against sharp stones. The conflict associated with this germ layer is called attack, defacement, defilement, or violation of integrity. If the doctor suddenly tells you that you need to have an operation on your stomach, immediately, the peritoneum reacts with cell proliferation, with a flat-growing tumor, with so-called mesothelioma. The wall towards the outside of the abdominal cavity becomes thicker, to protect against this attack. Which is the biological sense here? If the heart is to be operated on, the pericardium reacts with mesothelioma. This is what the pericardium often does during a heart attack. My heart, my heart. If the chest is attacked, perhaps from an attack against the heart, the pleura reacts. If you are spat on, the dermis reacts at the point of contact with cell proliferation, which is called melanoma. One can also feel sullied by a verbal insult, and thus develop a melanoma. Acne is the same program, only in a hanging healing. Pubescent people feel disfigured again and again by their acne, which makes the condition chronic. Women who have been operated on for breast cancer, and feel disfigured by it, very often react with melanoma on the operation scar. Do you see the language of Mother Nature, embroidered into our body and our subconscious? The cerebellum controls the glandular tissue of the sweat glands. By converting the sweat glands of the dermis into mammary glands, the first social behavior was programmed into the cerebellum. And now, there's a distinction between partner social relationships and mother-child social relationships. This meant that biological handedness became decisive for programs, affecting the old mesoderm germ layer. If you, as a biologically right-handed person, have a conflict of worries about your children or your mother, you'll have glandular breast cancer on your mother-child side. Which is the left side? The left-hander also has breast cancer on his or her mother-child side, but that's the right side. The cause of glandular breast cancer is a conflict of care. For example, care or concern about a child who had an accident, or a sick mother or partner. In the active phase of the program, the mammary gland cells divide. In order to increase the chance of survival of the sick child, mother, or partner, by supplying them with more breast milk. If the sick person becomes well, cell division stops. And the inactive glandular node is broken down by the associated microbes, which are fungal bacteria. The crisis in the middle of the healing phase is, apart from being cold, a stabbing sensation in the breast. Dr. Hummer refers to this as cerebellar pain. We also find this healing phase pain in the dermis, with a program called shingles. This is also the way the healing of melanoma and mesothelioma proceeds. At the end of healing, the tumor is gone. A quick interim summary. Organs related to the germ layer have germ layer related brain relays, germ layer related conflicts, germ layer related behavior, germ layer related their biological sense, germ layer related the handedness. New mesoderm programs, the biological sense. In our discussion of the behavior, of the sensible biological special programs and their biological sense, so far we have looked at the glandular tissue, brainstem, yellow group, and the gland-like tissue, cerebellum, yellow-orange shaded group. The brainstem and cerebellum, taken together, are called the old brain, or cerebellum. Now, we come to the cerebral medulla, which controls the connective tissue, orange group, and to the cerebral cortex, which controls the squamous epithelium and functional deficits, red group. The cerebral medulla and the cerebral cortex together are called the new brain or cerebrum. In sensible biological special programs controlled by the old brain, cells multiply during the conflict active phase. But in sensible biological special programs, SBS, controlled by the cerebrum, the tissue deteriorates via cell loss. The connective tissue controlled by the cerebral medulla is the virtual seat of self-value. A person with a healthy self-value has an upright walk. Someone who has suffered a collapse in his self-value has problems with his musculoskeletal system, scoliosis, spondylitis, lumbago, anemia, leukemia, bone cancer, arthrosis, arthritis, and so on. These sensible biological special programs create necrosis and osteolysis in the conflict active phase, until the tendon tears, or the bone breaks. In nature, this would turn you into prey. So, in these programs, nature does not help immediately in the active phase. First, you have to solve the self-devaluation. In the healing phase, and with the help of associated microbes, bacteria, these holes in the tissue are filled up again, with swelling, which is painful. Bone cancer in the healing phase is said to cause the worst pain. Toothache is a slight foretaste of this. This swelling gets stronger and stronger, until the crisis. After the relatively inconspicuous crisis, one feels cold, but the medullary crises do not have more symptoms, the swelling and thus the pain decreases. At the end of the healing phase, however, the bone remains thicker than it was before. So that this does not happen so easily again. And this is the biological sense here. As with a fracture, at the end of the healing process, the fracture is thicker and stronger than before, and remains so for the rest of your life. Therefore, there is a permanent functional strengthening here. A severe self-devaluation affects the bone. A more slight one the cartilage. In the conflict active phase of a cartilage program, necrosis occurs. This is incorrectly called wear and tear. There is no wear and tear. When you work hard, does the skin become thinner or thicker? Does the musculature become thinner or thicker? This cell loss in cartilage is also called arthrosis. In the healing phase, these necroses are replenished with swelling and inflammation, with the help of the surgeons, bacteria. And that is called arthritis. At the end of healing, when the inflammation has subsided, the cartilage remains thicker than it was before, for life. This is the biological sense of the program. Now, every bone, every joint has its own self-value content. The shoulder, I am a bad partner for my partner. With a right-hander, the right shoulder would be involved. With a left-hander, the left shoulder. In other words, biological handiness is also important in the connective tissue group. It's similar with the lymph nodes, only the conflict content is an even more slight drop in self-value. In the conflict active phase, necroses develop, which are not noticeable at all. If one cuts through such a lymph node, its holes look like Swiss Emmental cheese. During the healing process, the lymphatic tissue is replenished with the help of bacteria, and accompanied by swelling. It's the healing phase that's noticeable, and in conventional medicine, diagnosed as Hodgkin's disease. After the inconspicuous crisis, you feel cold, the swelling is gone. At the end of the healing process, the lymph node may remain palpable. A larger lymph node works better than a small lymph node. With fatty tissue, we come to a women's issue, cellulite. The slightest self-devaluation is that concerning the female shape. For example, when the father says to his daughter, "You have an ass like your mother." So the conflict content of the fatty program is, "I am out of shape." In the conflict active phase, the fatty tissue necrotizes. In the healing phase, it is replenished under swelling. And at the end of the healing process, it remains thicker than it was before. Which is the biological sense of the fatty program. Because in nature, fat is considered healthy and pretty. And lean is sick and ugly. To lose weight in nature is not difficult. You see, dear student, we think wrongly. We think unbiologically and often make ourselves ill. If we had the motto "chubby is beautiful," women would have cellulite much less often. We should also mention the so-called healing cysts, such as kidney, adrenal cortex, ovarian, and testicular cysts. These also belong to the new mesoderm group. But they do not have self-devaluation as conflict content. They are called healing cysts because they are found in the healing phase, and remain at the end of the healing phase. They are not broken down, because the cyst itself is the biological sense of the program. Therefore, the biological sense of programs of this group of connective tissue is only at the end of the healing phase, through a lifelong strengthening of function. For this reason, Dr. Hummer calls this group the deluxe group. In the programs of this germ layer, Mother Nature does not afford us the luxury of helping immediately, but, rather, at the end of the healing phase. And then for life. Remember, in the old brain-controlled sensible biological special programs, SBS, a tuberculous decomposition by fungi and fungal bacteria, mycobacteria, occurs only during the healing phase. Thanks to the help of microbes. In connective tissue programs, bacteria help to fill in the holes, created in the conflict active phase. Again, a quick interim summary. Now including microbes be crises. Organs related to the germ layer have germ layer related brain relays, germ layer related conflicts, germ layer related behavior, germ layer related biological sense, germ layer related the handedness, germ layer related epicrises, and germ layer related microbes, involved in the healing phase of the program. Ectoderm programs. The biological sense. The cerebral cortex is our most complex brain. It controls the squamous epithelium and functional loss. Here we have two major themes: separation conflicts, and territorial conflicts. Separation conflict. In nature, a separation is a catastrophe. If the child is separated from its mother, it is certain that the child will be dead. Dear mother, you will never see your child again. Forget him. Or, if the gazelle loses the connection to its herd, that is also its certain death. Dear family member, you'll never see her again. Forget her. The separation conflict affects the outer skin, the milk ducts. In case of a brutal separation conflict, the periosteum. Or in case of a visual separation, the conjunctiva, cornea or eye lens. In the conflict active phase, the affected individual always has impaired short-term memory. Alzheimer's disease involves many or severe separation conflicts. The mother forgets her child. Neurodermatitis and psoriasis sufferers also have problems with short-term memory. One must associate the tissues involved to the separation conflict. If the child always cuddles his beloved bunny face, and you slaughter his bunny, his skin symptoms begin where most of the contact was associated, on his face. During the conflict active phase, the outer skin ulcerates, causing cell degradation. Imagine a glue line that tears open. But this isn't the main biological sense of the program. Rather, the sense lies in the sensory paralysis of the involved area of the outer skin. It's effectively paralyzed by the senses, that is, numbed. This sensory numbness, in combination with the reduced short-term memory, helps to solve the cause, in the conflict active phase. The mother forgets her child, and the child forgets his bunny. To be able to continue life. Nature is again helping us immediately, in the conflict active phase, with these types of sensible biological special programs. In the healing phase, the ulcers formed during the active phase are replenished with swelling and inflammation. The skin is hot, and it itches and hurts. This manifests as atopic dermatitis, eczema, fever blisters, chickenpox, urticaria, and so on. At the end of the healing process, the skin is again symptom-free. The crisis in the squamous epithelium is always absence, which, depending on the conflict load, it can be an inconspicuous split second, or it can last for days. In the past, it was thought that the viruses were responsible for the healing phase symptoms of the squamous epithelium. However, it has never been possible to detect a virus under an electron microscope. In fact, there may be no viruses at all. The virus was a hypothesis of the chemist, Louis Pasteur, 150 years ago. Territory conflicts. The second major conflict theme of the cerebral cortex is the territory. This concerns the important matters of rank and reproduction. In nature, the wolf is not able to survive as a single individual. It must organize itself in a pack to be able to hunt successfully and exist. In order for this pack to function, it needs a hierarchical structure. Like we humans have the company, the party, the church, and so on. The company needs a boss, who gives the command. And many employees, who simply obey. Mother Nature realizes this hierarchy by means of conflicts, such as the classic territorial fight. The stronger defeats the weaker. The weaker one has now lost his territory. He suffers a so-called territorial loss conflict. A right-handed, or right-pawed individual will suffer a territorial loss conflict in the right territorial area of the cerebral cortex, specifically in the coronary artery relay. A territorial loss conflict for a left-handed, or left-pawed individual will night-hop, like the chess move of the knight or horse piece, and land in the left territorial area, specifically in the coronary vein relay. In these territorial conflicts of the cerebral cortex, we also see fixation. For example, if the alpha is part of the territorial program, then the defeated one is gay, and fixated on the alpha. If the mother is involved in the territorial program, perhaps because the mother leaves the family, the boy suffers the same territorial loss conflict. But is gaily fixated on the mother, he is Oedipal. He is now Oedipal, fixated on older women, or remains a bachelor. Naturally, homosexuality cannot be inherited. It always has to do with these territorial conflicts. And someone who has lost his territory is also no longer responsible for reproduction. He would rather be no longer responsible at all. When he is quite gay, his libido is virtually non-existent. We in Germanische Heilkunde say, he is cerebrally neutered. The cerebrally neutered male wolf, or dog, does not carry his tail high anymore, it hangs low. He no longer lifts his leg to pee, but squats like a female. And if the alpha gives the command, "We'll get this hind," the cerebrally neutered second wolf says, "Yes sir." And this is how the pack can successfully hunt, and exist. Now, if a female ovulates, the alpha is available. The alpha is the one who has no territorial conflicts. The second wolf does not want to mate at all. In this way, the female always has the best as a father for her young. Which female would be satisfied with the second best? It's a fundamental principle of Mother Nature, that only the best, leading male can reproduce. Contrast this with the topic of abortion. In our civilization scrap society, we abort everything, even the healthy, and keep the weak alive with enormous effort. Where's the moral or ethic? The special programs of the territory include the bronchi, larynx, coronary arteries, liver bile ducts, small curvature of the stomach, rectum, and urinary tract programs, and more. These hollow organs are internally lined with squamous epithelium, which ulcerates in the conflict-active phase, thus increasing the volume of the cavity within. This allows more air to enter the lungs, more blood to reach the heart muscle, and more urine to exit in order to better mark the territory. In this way, through cell loss, there is a functional strengthening. This is how Mother Nature helps immediately, in the conflict-active phase, to solve a territorial conflict. By the way, in connective tissue, this cell minus in the active phase is called necrosis. In squamous epithelium, which is usually only as thin as wallpaper, this cell minus is called ulceration. If you scratch something out of the wallpaper with your fingernail, what remains is an ulcer in the wallpaper. In the healing phase, these ulcers are replenished with swelling and inflammation. We see this as pneumonia, jaundice, cystitis, and so on. The coronary arteries are also repaired under swelling. Up until epicrisis, the whole squamous epithelium repairs itself without microbes. In fact, viruses almost certainly do not exist at all. The crises are noticeable in this germ layer. In addition to coldness, which is common to all crises, we have absence in all squamous cell programs. In the hepatic bile ducts, we also have hepatic coma due to simultaneous hypoglycemia. In the coronary arteries, in addition to the classic myocardial infarction and absence, we have a pulmonary embolism. With these last two special programs, the crisis would be fatal if the conflict load was more than 9 months. In such cases, the conflict should not be solved. After the crisis in territorial programs, the swelling goes down. And at the end of the healing phase, one is symptom-free again. Ectoderm, the biological sense. Because the sensible biological special programs, that involve loss of function, are all controlled by the cerebral cortex. Dr. Hummer placed them in the red group. These include motor paralysis, loss of the senses of smell and sight, and diabetes and hypoglycemia. Also controlled by this germ layer are rheumatism of the periosteum, and other sensible biological special programs. Different types of conflicts are responsible for these cortical programs. I would like to mention 2 examples. First, paralysis. When a rabbit can no longer escape, it suffers a motor conflict of not being able to escape, and it is paralyzed. If you now set this rabbit on its paws, it will sink down. This functional loss in the conflict active phase is also the biological sense of the program, it's the apparent death reflex. Then, the predator pulls back and lets go of the rabbit, because he no longer has to kill anything that is already dead. In this way, the rabbit can survive the situation. In crisis, he has an epileptic seizure. And at the end of the healing, he runs again as if nothing had happened. Polio is this same program. In the case of polio, it was thought that a virus was to blame. But, as I said, no virus has ever been seen before. My second example of functional loss is diabetes. If you resist your superior, the beta islet cells of your pancreas stop producing insulin, and you have more sugar in your blood, and thus more energy in the conflict active phase, to solve this conflict of resisting more successfully. In the healing phase, a critical level of hypoglycemia comes just after the crisis. At the end of the healing phase, blood sugar has returned to normal. Now, take notice. Up to now, the biological sense of every program has always been to strengthen the function. Either in the conflict active phase, in glandular tissue, gland-like tissue, and squamous epithelium, or at the end of the healing phase, in connective tissue. But here, in this group of programs, the biological sense of the program is functional loss in the conflict active phase. As Dr. Hummer said, nature can do everything. The crises. Germ layer related special programs also have germ layer related crises. If a conflict can be resolved, the crisis always comes in the middle of the healing phase. And it's inevitable, just like birth always comes during pregnancy. In itself, the crisis is a good sign, and reason for happiness. Because it means that the conflict has been solved. And the crisis has a very important purpose, and shouldn't be dampened. At best, it should be reinforced. You always experience the crisis, if you have resolved the conflict. The critical point is after the crisis. And that's because, with conflict resolution, you fall into a deep vagatonia. Your narrowed blood vessels, which formerly gave you cold extremities, now widen and give you boiling hot extremities to fever. Meanwhile, in the brain, the Hummer focus during the conflict active phase of the program looked like a shooting target, and had no spatial requirement. But after conflict resolution, the involved brain relay becomes edematous. By the time of the healing phase, PCLA, this brain edema has gotten bigger and bigger. The cerebral pressure increases and causes corresponding brain symptoms, such as nausea, dizziness, vertigo, double vision, etc. On the organ level, old brain tumors of the glandular and gland-like tissues, which are now no longer needed, are broken down tubercularly, by fungi and mycobacteria, with swelling. In new brain programs, the necroses of connective tissues are replenished by bacteria, with swelling. Ulcers of the squamous epithelium are replenished with swelling, but without microbes. Viruses do not exist. These organ-level swellings get bigger and bigger during the healing phase, and therefore the pain becomes stronger and stronger. From the moment the conflict is resolved, one feels worse and worse. To stop this process of falling into vagatonia, Mother Nature has built in the crises. With the momentum created by the crisis, the whole organism is turned back in the direction of health. Most crises occur in the deepest vagatonia. That is, in a healing phase, and at around 4 a.m. The crisis is often initiated by a dream. The affected person dreams again of his already solved conflict, thereby going back into the stress of it. And in this way initiates the crisis. All crises are sympathicotinous, with constriction of the vessels and cold sweat. There is nervous system centralization. Depending on the load of conflict, the crisis can be a split second and pass unnoticed, or it can last several days. With pre-crisis, major crisis, and post-crisis. And all crises are symptoms of the brain. Even a heart attack has nothing to do with the blocked coronary artery. What's really going on is that no more signals arrive from the heart center in the brain to the heart muscle, this causing the cardiac arrest. Through constriction of the vessels, during the crisis, the previously stored edema in the brain and on the organ level is now squeezed out, and the so-called urinary phase, PP phase, begins, in which one often has to frequent the toilet. Crises of the brainstem, cerebellum, and medulla are inconspicuous, apart from centralization, constriction of the vessels and cold sweat. The conspicuous epicrises are those of the cerebral cortex. Here, in addition to centralization, we also find absence during the crises of all squamous epithelial tissue sensible biological special programs. At the relays of the coronary arteries, during crises, we see arrhythmias, tachycardia and cardiac arrest. With the functional loss programs, in addition to centralization, we'll also have epilepsy and hypoglycemia, for example. It's after crisis that one falls back into deep vagatonia and reaches the critical point. This is the moment when it's decided whether the conflict load was too large or the crisis too weak. In either of these cases, after the crisis, the patient falls into the deepest vagatonia and then into death. But if this critical point is passed, because neither was the conflict load too large, nor was the crisis too weak, then it will be a giant step uphill towards health. Doctors used to say, "Now, he's over the mountain." The mountain is the crisis. And so, germ layer related organs have their germ layer related crises. So, these are all the common threads, now. Germ layer related organs have germ layer related brain relays, germ layer related conflicts, germ layer related behavior, germ layer related biological sense of the sensible biological special program, germ layer related the handedness, germ layer related crises, and germ layer related microbes. As I said earlier, understanding the principles of so-called diseases is now easier through Germanische Heilkunde. You do not have to remember everything, only a few common threads. Once you have found them, you can deduce a lot. Although the brain level is not accessible to us laymen, we non-therapists can still talk to the affected person. We can ask him about his conflicts, psyche level, and query his symptoms, organ level. These three levels, psyche, brain, and organ, are always synchronous since the individual is not divisible. If one level is known, one can draw conclusions about the other two levels. The therapist will always use all three levels to find the conflict, the cause. As a medical layman, one should always start with the tissue symptoms. Because the organ level cannot lie or deceive. An organ symptom is easier to pin down than the possible conflicts. We all tend to psychologize, and have not yet fully understood the biological language of nature. But now, if you know the tissue, for example, connective tissue, then you know what to look for. In this example, a self-devaluation conflict. Additionally, by knowing the handedness of the affected person, you know whether this self-value collapse has to do with partner or mother-child. You also know whether the conflict is active or resolved. In the conflict active phase, necroses develop in the connective tissue. This does not hurt, so this phase is often overlooked. But the healing hurts, and usually hurts immediately after conflict resolution. So if, for example, the affected person complains that he or she has had knee pain since the beginning of August, then you know that at the beginning of August she was able to solve a sportsmanlike self-devaluation problem concerning, for example, a partner. The conflict was sometime before. Now you can look for it on the level of the psyche. Was it a sportiness self-devaluation in regard to father, brother, or soccer colleagues? You can recognize a biological conflict by the three criteria. It felt highly acute and dramatic, isolating, and like getting caught completely unexpectedly. And of course, the conflict resolution must also fit the conflict, like hand in glove. The person concerned tells all this of his or her own free will, if you ask the right questions. If this conflict was at the beginning of May, and resolved at the beginning of August, then you know he will have these healing phase symptoms until the beginning of November. The swelling and thus the pain will get worse and worse until the crisis, which is expected in mid-September, though it will be inconspicuous as a centralization. Starting in the middle of September, the swelling, and thus the pain, will subside. At the beginning of November, everything will be cleared up. It is possible that the stronger connective tissue, which is the biological sense of this special program, will remain. You see, dear student, how with a knowledge of these biological connections, on one hand we can find the cause, and on the other hand we can recognize how long the symptoms will persist. This helps take away fear, and that's very important for avoiding secondary conflicts. And not being chased into the foxhole by ignorant people. And, I would like to mention again, that these biological laws of nature are also valid for animals. The Hummer's compass, what we've discussed so far is summarized on the so-called Hummer's compass. The old brain-controlled group, brainstem and cerebellum tissues, multiplies cells during the conflict active phase. The new brain-controlled group, cerebral medulla and cerebral cortex tissues, causes cell loss or loss of function during the conflict active phase. In the healing phase, tumors of the cerebellum group are decomposed by the associated microbes, and the necroses and ulcers of the new brain group are replenished with swelling. Common to all sensible biological special programs is that they start with a biological conflict, DHS. And, if that conflict is resolved, the system becomes two-phase. With conflict resolution, our brain switches on the associated microbes, which work germ layer dependently and would never change tissue. The microbes are not our enemies, but our surgeons. In the middle of the healing phase is the crisis. As long as the conflict active phase has lasted, the healing phase will last. At the end of the healing phase, we are absolutely healthy again, including from the point of view of conventional medicine. Only harmless scars remain. Furthermore, this third biological law of nature discovered by Dr. Hummer shows that cancer has nothing to do with any degeneration, but that the process follows natural laws. It also shows that only the patient himself can name the cause, and only he can eliminate the cause. It is only the affected person himself who can heal himself. The affected person is the boss of his procedure. Nobody can take this away from him. The therapist is only a helping hand. A patient must understand this, if possible, before he is diagnosed. Because it is difficult to teach a drowning person to swim in the short time available. Mother Nature is perfect and is always right. We humans cannot change the laws of nature. Trying to live against the laws of nature causes suffering. We have to learn to understand them and adapt to them. Automatically we would have fewer conflicts, be healthier, and also happier and more satisfied. I thank you for your attention. Helmut Pilhar. father of Olivia.